In this video, we are going to talk about bed mobility and safe positioning in bed after your hip replacement surgery. In general, it is recommended that you sleep on your back with a wedge or pillow placed in between your knees. If you like to sleep on your side, it is recommended that you sleep on the side of the operated hip if it feels tolerable. It is not recommended to sleep on the opposite side of your operated hip because you may twist, rotate, or cross your operated leg. Rotating and/or crossing your legs will put stress on your operated leg and break your hip precautions. First, we will go over how to get into bed after your hip replacement surgery. First, you will back up to the edge of the bed until you feel the bed on the back of your legs. Then, you will reach back for the bed and slowly sit down while extending your operated leg. You should extend this leg so that you do not break your hip precautions while sitting. Once you are seated at the edge of the bed, you will begin to rotate your body towards the foot of the bed. Once you are facing the foot of the bed and can no longer turn without lifting your legs over, you will lean back and lift each of your legs over the side of the bed. Once your legs are on the bed, you will remain in a lean back position, propping yourself up with your arms or forearms. If you are not close to the center of the bed, you can carefully scoot each of your legs one at a time towards the center of the bed. Now we will go over how to get out of bed after hip surgery. From lying down, you should prop yourself onto your elbows to prepare for moving closer to the edge of the bed. Then you will slowly move your legs in small movements closer to the edge of the bed, following with your torso and your upper extremities. You should gradually keep turning until you are able to place your legs over the side of the bed and push yourself up into a sitting position using your arms. If your hip precautions restrict hip flexion, it is important to pay attention to your upper body, as you should not be bending past 90 degrees at the hip. If you find this difficult, you can extend your knee to help widen the hip angle so that you will maintain your hip precautions. It is noted that you can use a leg lifter to lift your legs while transferring on and off the bed. Furthermore, it may be necessary to use a leg lifter to move your legs if you have restrictions on active abduction in your operated leg. Here is an example of how to use a leg lifter while getting in and out of the bed.